Hello and welcome to a very special cover story conversation. I have with me Dr. UJJWAL NEOGI. He is a coordinator and a senior lecturer at the Combat Project. And why is that important? The Combat Project is an Indo-EU venture. It's an initiative on the forefront of dengue research and pandemic preparedness. But also, Dr. Neogi is a molecular and systems virologist. He has an expertise in immunometabolism, and he also founded the Systems Virology Lab at the Karolinska Institute in Stockholm, which, as you know, is one of the world's foremost medical universities. So welcome to this very important conversation. Dr. Nyogi, we've also had the Prime Minister visiting your area recently, and we've also had the Indo-EU FTA that has been signed, which, calls for an exchange in information technology, especially in digital health, biotechnology between the two, Europe and India. So the work that you're doing is something that is really important. Also, I would like to tell our viewers that dengue is something that kills as many as 100 million cases worldwide, out of which 1 million have been found in India alone in the last 4 or 5 years. So it is something that is really a cause of concern for us in India. But Dr. Nyogi, now I will over to you. What exactly are you doing, and what is the research that you do?
Yeah, thank you, Priya. So our research on combat is to understand why some people goes to a severe disease, and can we able to identify them early and then treat them early so that they don't go to the hospital or succumb to death. So we are using cutting edge technologies, different analyses like artificial intelligence and others, which is actually foremost thing that now India and EU is looking for following the Prime Minister visit, that AI is the one of the domain. And what we are trying to using this artificial intelligence to find out if a patient will come to hospital to the doctors after dengue, can we detect them whether they will go to severe? If they are going to severe, then we can hospitalize them. If we are predicted not to be severe, so they can go home and they can be monitored remotely and then come back if needed. So we are trying to use this kind of method to identify the severity.
Okay, and this is something that you not just used in dengue also, but any, a lot of other diseases that are virus based, whether it is Japanese encephalitis, the Congo fever, a whole lot of other diseases also that you're working on.
Yes, so I started my career with HIV. So I did actually PhD from Karolinska Institute, but I was placed that time in Bangalore at St. John Research Institute. And then before that, I was in National Institute of Immunology, New Delhi. So that time, whole work was on HIV, and again, try to find out which HIV infected individuals are not doing well with therapy, because all are not doing well. It's few of the people. So and try to identify them using the similar method. Then when SARS-CoV-2 came, so that time also my team worked on SARS-CoV-2. Then Japanese encephalitis with Indian partners from Regional Center of Biotechnology. Then we work with Crimea Congo hemorrhagic fever, that is with Turkey. But Crimea Congo hemorrhagic fever is also there in Gujarat. There's a report of that. And now we are into dengue to understand those. And we will slowly expand the team because the method that we are developing can be applicable to any infectious disease.
Uh, any infectious diseases is virus based or
Virus-based or bacteria-based also, because mainly sepsis, like antimicrobial resistance, is a
Mhm.
problem. So even sepsis patient, we can detect, okay, all sepsis patient need? Because when we go to clinic, like doctors do finger prick test called CRP test to see there's
Okay.
inflammation or not. But we are trying to expand that one to 1,000 proteins, that is like CRP, so that we can find out is there any specific that can actually identify not only the severity, but also is it any disease specific, because sometimes all these diseases show similar pattern in the beginning.
So yours is a predictive technology, or is there also curative also?
Yeah, so it's predictive, but so one of the part is prediction, and then we will go to the lab to prove that prediction that, okay, yes, this is the real scenario. So this is one of the beauty of the combat project, because we start with the prediction and then we will validate that in the lab as per using the, again, advanced technologies and assays.
Okay, this combat project was started recently, or can you tell us a bit about the project? How
Yeah,
old is
so
it?
the project was started in November, and when the EU has approved the project, and then the Indian project was started from 1st of April this year, because the Indian project was for 4 years, because we know that there will be lots of paperwork to be done, lots of extra. So this mechanism actually, uh, they like now going to be formalized with the EU Horizon and India MOU. So I think that is going on now presently. And I was in touch with the EU embassy in New Delhi. So they are really excited, because this will be combat is one of the landmark project for that kind of signing. So because they realize that, okay, if we go for two round of review, it will take time. So rather, like with other EU partners, they to happen like when EU funded this project, automatically get funding from the other countries, other partner countries. But it was not there in India. So India, it will be funded by EU. Then India will review that project for the Indian partner, because we have 5 partners in this project from India, and then it will be funding will be released. So that's why it took little time, but now we started from 1st of April.
So the Indian partners are government or they're private partners also?
Yeah, so they are both. So the Indian coordinator is National Institute of Biomedical Genomics from Kalyani, West Bengal, and then a Regional Center for Biotechnology, Delhi, Faridabad. Then we have 3 hospitals. So they are Max hospitals, and then Artemis Hospital in Delhi, and then South Manipal Institute of Virology in Mangalore.
But we just our world just recovered from the pandemic and the COVID cases. So how would this technology will it help in are there any preventives that you can also offer, or is it something that your technology and the AI comes in post the infection, or is there a preventive? Can it be used
No,
for
so
preventive work?
yes, so we are also trying to do the modeling study to
Huh?
see, okay, which disease can come early, because we will do lots of modeling to find out, okay, will dengue come this severe stage for next 2 3 years.
Okay.
So that kind of modeling study is also going on. So we want to see how the study, but this study is mainly done in Guatemala, which is our primary cohort. And then also we want to find out something that is globally acceptable. So that's why we call it discovery in Guatemala, validation in India, and then vice versa, like discovery in India. But it should be the same outcome that we want to do. So yes, we are doing modeling study to identify how the epidemic will go on. The way you have seen during the COVID, there's a dashboard to see prediction happening that this will go up, this will
Will
go
go up,
down.
this will go down.
So we will do the same thing.
And, that is really when the mosquitoes really flourish. I mean, of course, with global warming, even Sweden and Stockholm are not, immune now to dengue cases. But how do you see, in terms of your prediction, or India cases, are they rising? Are they going low, less? So what is the prediction for this year's monsoon?
Yeah, I think it's like
It's like
every year has a different pattern. Some year is going high, some year is going down. For example, last year it was quite high. 2024 it was quite high. Then 2025 it's little bit low, but again this year it started early. But one of the concerning thing is that we have seen in Guatemala, and mostly it will be true for India. Like earlier, dengue was like June, July to November, but it's now all over the year. Even January we are finding dengue cases. So that is because of the global warming and the urbanization. And like it will be impossible to stop dengue, but I think there's a way to prevent that one, like also the societal intervention, like mosquito control, but also like if we can identify patient early so that we can save them.
Well, the symptoms of dengue, are very painful apart from everything else. There are a lot of joint pains. Is there any advice you can give, or, and also are the Indian strain, is it different from the ones elsewhere? Is there anything that differentiates the Indian strain?
No, the strains are same, but what happens, it changes every year sometime, because some dengue too is more problematic or more severe. But dengue 3 is not that much. But now dengue 3 we have seen in the lab, it can actually infect brain cells. And dengue 3 was there last year in Latin America. So that gave a huge, massive outbreak kind of thing. And then so it's very difficult to control. So like if during the dengue season, if there is kind of fever with joint pain, and it's better to seek early, immediately to go and check if it is dengue or not. If it is dengue, then to try to take as much as protection. Yeah, unfortunately, there is no approved antivirals,
I
but
was just going to
now,
ask you that.
yeah, so this is mostly supporting, like giving platelets or giving painkillers to subsidize. But good thing is there. I know because I was visiting Takeda last week in US. So there will be actually a launch of Takeda vaccine in India. So it is now approved by the committee. So
What is this
hopefully
vaccine?
it's called Qdenga or TAC03. So
Uh,
this is for dengue Takeda vaccine, and I think it will be launched soon. So hopefully
in India.
this vaccine works. Yeah, in India. So hopefully this vaccine works properly.
And where are we on the Japanese encephalitis? Because we had a very severe outbreak recently in eastern Uttar Pradesh. I don't know. You must have heard about the
Yeah,
Gorakhpur case.
yeah. Yeah, so Japanese encephalitis, there is a vaccine available, but I am not sure fully about the coverage of the vaccine. So the research that we are doing on Japanese encephalitis, mainly again to give a combination therapy, like also like targeting the virus, but also host, because most of this disease, it goes to the severe stage, because for example, in dengue, it's only 1% of patient will reach to severe case,
I
but still
see.
1% is a quite big for a country like us. So that's why we are trying to, like, what happened in the later stage, our body start responding and it cannot control the response. So there are lots of, you might have heard during the COVID called cytokine storm.
Yes.
So that is also true. So what we are trying to identify, that can we give the antivirals? So there's a lots of research is going on in India on antivirals. But we are trying to see, we call it host targeted therapy, or like that targeting our host. It's basically like taking antioxidant to protect ourselves from so we are trying to find out what are the molecular pathway the virus use, and then we try to target those so that virus cannot use those.
So this the use of AI, as you know, will help you target the pathways and find the pathways. Do you see that playing a now bigger role in terms of our digital health? Is AI is going to take over, and how much do we trust for a layman person to trust AI?
Yeah, so it's a very good question. So we have a term in our research called trustworthy AI. So there is a guideline for that we have to follow
Okay.
those. Yeah, it will certainly fasten our progress, but I don't think it can fully take over the human intervention, because that is mandatory, because at the end I will give the command to the AI to give me the output. So if it is used
The AI is
properly,
as good as you are, as the user is.
yeah, so it's, and also it's kind of, it depends on if you use ethically, because for example nowadays you might have heard lots of, like, student are using AI to write thesis. It's absolutely fine if you use ethically. So what we teach our student, that how you should ethically use AI, because that is very, very important, because there is also like study, like report has came up that completely fake AI algorithm was built. So it again depends on the user how they want to use.
So that's pretty interesting that you are also, teaching the students how not to fall into the trap of fake
Yeah.
AI or and also, but is in terms of for a routine person, I'm just shifting you from your core area, but just to help us understand the use of AI and health, is that something that, for a routine checkup, or now a lot of people are saying you can do cancer screening tests with the help of AI, will tell you whether you're predisposed to cancer or not. Can that be used for other viruses also?
Yeah, so this is one of the objective also for us. When we gather all the different virus, not only dengue, can we predict based on the symptoms? So we call it endotype, like based on symptoms and based on our molecular or biochemical data. can we predict this particular disease? So this is also one outcome that we want to follow it up. But the problem with the virus, we generally this AI-based prediction is very good in cancer or diabetes, those kind of outcome. But in virus, it's like every day is a different, because if you can see normally also symptoms, like first 2 3 days of fever you feel very bad, and then slowly it's better. And so that's why every day is better. So we just actually wrote a perspective article on that, that not to just follow the cancer, rather follow like the virus and it's how it changes over time to see. So it's possible. This is one of our dream project, this one, to see can we predict based on, because what we'll develop a small app. So this app will go to the clinic. Doctors will put the patient demographic data and biochemical data, and then it will tell, oh, if the patient is going to be severe or is going to be mild or moderate. So there'll be app coming out from this also.
Wow. But where are we on the COVID predictions? Can you predict whether there'll be another outbreak?
COVID outbreak is still going on, because we as we are vaccinated, we are not feeling that one. Even if you see in COVID, it's only 1% those who actually went to the severe disease. But the thing is, it spread rapidly and so rapidly that our healthcare system cannot take care. So if we have a proper healthcare support, even I think we could have solved this thing. And this is also true not for India, it's also true for Sweden. We have seen, because our next door is a hospital. So we have seen that they are keep on like closing one of the other unit and then adding that as a COVID ward. So that way, like I think if we are now we are much better prepared, we know what can problem. For example, now you might have had two more outbreak has happened going on. One is Hanta in
Yes.
the and the second one Ebola last week. So now I think we are much more prepared at this stage, and then hopefully the healthcare system can cope up, because most of the time if the patient get a healthcare support, they can easily come out of the system.
We don't have to live through what we lived through COVID times. But a little bit about yourself. What made you take this field of medicine? And
Yeah, so it's very interesting. So I did my master's from Bangalore University. And then that time I started looking which area to work. And then it's for me, HIV was fascinating. And I got internship in National Institute of Immunology under Professor Akhil Banerjee. And then I got interest. So then I decided, okay, let me go PhD. The PhD, what I did, I actually did it with called sandwich PhD. So I got a degree from Karolinska, but I was placed in India. I got a scholarship called Erasmus Mundus Scholarship for Indian student. And then after getting that degree, I actually came back for a short time in India with Wellcome Trust Early Career Fellow. But then I decided, because that time I started doing this omics work, and that time it was not there much. So I went back to Karolinska. And then suddenly I started getting funding. So I have my lab soon. And then for dengue is actually very personal thing why I jumped into dengue. So I was in a crematory place for my father-in-law's death, and then I found a very young, like 40 years of age person like died, and then I started looking into the overall. We know there is a problem in dengue, but I didn't look in that detail. And then suddenly I saw, okay, the thing what we developed for HIV could easily be implemented in dengue and other diseases. So let's try that one. So that way we started doing studies, initial data, and then go for dengue. And then also one of my research is in Sweden or there, that I bring lots of Indian origin researchers. So in combat, there are several Indian origin researchers, so
oh,
that
good.
we can understand each other better. And then they came from different fields. They came from physics, some came from engineering, some came from cancer, and then try to use interdisciplinary research to make the process or the discovery faster. So this way
Well,
I started.
well, that's interesting. I was going to say India's loss is Stockholm's gain, but you also made it India's gain by getting, this research, Indian researchers there, and of course, this combat is a joint venture. On that note, but What next for you? Where do you see AI taking you next?
So I think
What's
next
the
thing
big
what
challenge
we
next? Big.
yeah, the big challenge for AI and application in healthcare is again the ethical implications.
Yes.
If you do properly ethical, and also education is important. Like we should teach our even young kids not to follow ChatGPT very well or any other AI tools. So they should know what is right and wrong. That the way we teach here, how you ethically use the AI. And then the second challenge would be to acquire all the knowledge and then translate that. So not only like the doctors or the clinicians who are checking, they should not blindly follow what is there because we also need a knowledge gain and that kind of aspect. So AI will be certainly be helpful to early and make the process faster, but we still really need the knowledge or the merit of the human intervention
And the experience. So
and
your
the
job
experience,
is
obviously.
so your job security is very much there despite AI. But on that note, thank you so much, Dr. Nyogi, for this conversation. I think it's been an eye opener for me also and for our viewers. So thank you very much and all the best and hope to see you in India soon. We can
Yeah,
continue this
thank you.
conversation here.
Yeah, thank
Thank
you.
you.
For more such videos, subscribe to the Newsx YouTube channel, hit the bell icon.